So our first speaker is Dr. Bodani. Dr. Bodani is a Saskatoon-based psychiatrist who graduated with her Bachelor of Science and MD from the University of Saskatchewan, homegrown talent, before she moved to Ontario to complete her residency at Western University in London. She has a particular interest in patients with psychiatric and medical comorbidity, as well as sleep disordered patients, and she recently completed a 2-year diploma in sleep medicine through the Newfield Department of Clinical Neurosciences at the University of Oxford, where she's currently enrolled as a Master of Science candidate. That's new information to me too. She's a busy lady. She's an assistant professor in the Department of Psychiatry at the University of Saskatchewan, where she currently holds the position of departmental CME director, and she actively engages in teaching psychiatry at the undergrad and postgraduate levels. I've seen Dr. Bodani speak before, and I am extremely excited to have her presenting with us today. She's got a wealth of knowledge, and so without further ado, here is Dr. Bodani.
Thank you so much. I'm going to go ahead and share my screen and bring up my presentation here. Okay, yeah, so now you know all about me. And if you've heard me before, and sounds like at least some of you have, you know that I love to chat about sleep. So that's why I welcome, I don't think I've turned down an invitation yet to chat about sleep, because I just value it so much and I know that how important it can be to people. So just to start off, I just want everyone to know that I have no disclosures or conflicts of interest here. My only objectives today is to just remind everybody about the importance of managing sleep when you have a chronic pain condition, and to teach you some good sleep hygiene tips that will try to clean up and protect your sleep. So I'm going to zoom through here as best I can. So a tale of two common problems, because it really, really is. And there's a lot of data out there, a lot of surveys they've done in people with all kinds of chronic pain conditions, et cetera, where we see that there is just a really high rate of comorbidity, meaning people suffering with both conditions, sleeplessness, insomnia, and chronic pain conditions. So how does it relate to pain? Well, pain can cause insomnia, which I'm sure everyone can intuitively assume. And in the acute setting, the sleep problems could just be just because of the pain itself. But what we know is that if you have sleep problems and sleep disruption long enough, the sleep can break. It's like your brain forgets how to sleep properly, and then you can develop a whole secondary problem that we call psychophysiologic insomnia, or just plain old insomnia, right? Which is that now you have not only this other medical condition, but you also have sleep, which even with good pain control could remain a little bit fragmented. And that's really important, because while we know pain can cause sleep, pain can cause sleep loss, which affects your health, we also know that sleep can actually impact pain. And there's lots of work out there that looks at the impact of poor sleep or less sleep or fragmented, broken sleep on pain. And there's lots of research on looking at, biochemical things in the body, the rates of inflammation when you have worse sleep, and even just ability to cope with pain when you have worse sleep. And so actually the data now suggests that sleep is more likely to impact pain, like that it's a heavier weight in that direction than pain is to impact sleep. And that's why it becomes, I think, so important that we consider it. So, you can start a fist fight at a sleep conference if you ask someone, what's the most important thing about it? What's the purpose of sleep? And people will have all kinds of, really interesting philosophical and physiologic debates about why do humans sleep? Why do animals sleep? But whatever it is, we know that without sleep, you don't have optimal functioning of your body. Like we know when it comes to your health, the better you sleep, the better able you are going to be able to tolerate any kind of illness. And the worse the sleep, the less optimal the functioning. And so there are unhealthy solutions that people turn to often. About 40% of people with a sleep problem will self-medicate using Gravol, drugs, alcohol, that kind of thing. And these we know long-term are not going to solve the problem, and they might cause other problems. But there are healthy solutions, and that's what I want to talk to you about today. So In terms of, if you're noticing that your sleep is breaking a little, or it's just not as good as it used to be, or maybe you have full-blown insomnia, where do you start? And a good starting point is always with fixing your sleep hygiene, and then maybe talking to your physician or your healthcare provider to see if there's any other solutions. And if there's nothing else going on really, and it just seems to be this kind of really bad inability to fall asleep or stay asleep, you could always look at getting proper cognitive behavioral therapy for insomnia, which is a topic for another day. So today I just want to focus on that first step, that good sleep hygiene step. Like, what are the ways to improve your sleep? This is an essential part of sleep treatment, even if you have a severe sleep disorder. Good sleep hygiene is going to be one of the first steps to getting better. And if you already have good sleep, it's actually protective. If you maintain good sleep hygiene, you're going to protect that sleep from anything that might exacerbate it or break it a little bit. So I'm going to whiz through some of these because I know this is a quick presentation, but I'm going to spend a bit of time on the pieces that I think are most important. So sleep hygiene, this is a cute little chart. If you want to take a screenshot, this is the one to take, right? Of the instruction of kind of what a good sleep hygiene tip is, and then some rationale, like the reasons that we would do these things. A lot of these things are going to sound intuitive as I talk about them, and that's okay. But you know what? Even good sleepers sometimes forget some of these things. I watch TV right before bed, and everyone says don't do that, and I know all the good reasons to not do that, but sometimes I do, and that's okay. I usually tell people, if you have really good sleep, it's okay to break some of these rules. So don't think of this as being a very rigid structure of rules that you must do. But if you're noticing your sleep's vulnerable, it's not so good, this is the stuff you want to focus on to clean it up. Okay, so don't feel super guilty if you break some of these rules, but these are some good ways to change things back if you're noticing problems. So one of the first ones that I want to focus on is this one: sleep only as much as necessary. And that means only go to bed when you're sleepy. A lot of people assume that more sleep means better health or better rest, but actually there is such a thing as too much sleep. We know that how much sleep you need is very much programmed in your genes. Like, there are people out there who only need 6 hours, and then there's people out there who need 9 hours. And it's not up to me or any other healthcare provider to tell you exactly how many hours you need to sleep, but you probably have somewhere in that window between 6 and 9 hours a right amount that's healthy for you. We know that if you regularly obtain more than 9 hours of sleep, it can actually be associated with negative health outcomes. So there is such a thing as sleeping too much. And the other thing we know is if you're spending a lot of time in bed, but not really sleeping, what you're going to do is break up your sleep, right? So, if you're going to bed at 10 and not getting out of bed until 10, that's 12 hours. And you might only get 8 hours of good sleep in there, but it won't feel as good as if you were in bed for 8 hours getting 8 hours of sleep, right? Because then that sleep is, think of it as diluted, fragmented, more shallow instead of a good solid 8, something like that. So when you're thinking about going to bed, think about why you're going to bed. Are you going to bed because you're actually sleepy and ready to go to sleep? Or are you going there out of boredom, because of fatigue, not sleepiness, but just tiredness, because your pain is high, because you're feeling down or sad? There are a lot of reasons people actually go to the bed. And really, we should only be going to bed when we're actually sleepy. So, I tell everybody it's good to move your nighttime wind down routine out of your bed. Be perfectly ready for bed, get changed, empty your bladder, all of that. Get comfortable somewhere outside of your bed. Stay in a dimly lit space. Avoid all those bright screen lights and phone screen lights and TV lights. And then do something boring and relaxing until you feel sleepy. And then when you feel sleepy, pick up, go to the bedroom and turn off the lights. And that's really good, tight sleep hygiene. And this is really what we're talking about. When we talk about having a regular bedtime, that's a problem if you're going to bed at the same time every day, just because you think you should, if you're not actually sleepy, right? So it's more important to go to bed when you're sleepy rather than going to bed because of the time on the clock. What if you're bedbound? Okay, so there are a lot of people I've met who have a lot of pain, who are bedbound. And so at that point, I would say, if possible, try to change the environment between night and day, right? Consider the lighting: bright lights during the day, dim lights in the evening, and off it completely when you're ready to go to sleep. And remembering that rest is different from sleep. when you're resting, you can still rest awake, but you can try, if possible, if you're not completely bedbound, if you need to lie down to rest during the day, try to do that in a different environment, on the couch, even resting in a chair. Lying down might be good for you physically, but try to do that. If there's no other space, flip yourself around so that you're kind of upside down in your bed. Your head is where your feet would be and your feet are where your head would be, just to change the environment. We want to make sure our brains know the difference between wanting to go to sleep at a certain time and just resting. Okay. Wake up at the same time 7 days a week. I said a bedtime maybe isn't as important. Having a normal routine at night is good, but you don't have to have a solid bedtime. But one way you can really help anchor your day-night rhythm, and this is a funny looking graph, I know, and I won't explain it really, but it's about wake. So you can see here, wake is when these waves start going up, and these waves represent your circadian rhythm. That's your day-night rhythm, and your sleep drive. And so if you anchor your wake at the same time every day, you're more likely to be able to fall asleep around the same time every day. So more important than a regular bedtime is a regular wake time. And so pick a time that works. Sleeping in on weekends can be a great way to catch up on lost sleep, but it will cause a little bit of what I call social jet lag, right? We always talk about jet lag when you're traveling out of country because the clocks change, but you get a bit of social jet lag if you change your day-night rhythm by sleeping in really late on a Saturday morning and then staying up really late on a Saturday night. So it's okay to do that, but you have to know that somewhere the sleep's going to give, and that's usually Monday morning. Because you've slept in Sunday, you can't fall asleep early enough Sunday night. Everyone's going to bed early thinking, oh my goodness, I need to be up Monday. But really, you shouldn't do that. You should stay up nice and late Sunday night so you have a good, deep, consolidated sleep. Wake up early Monday. Know it's going to be a bit of a rough day, but have a great sleep Monday night, right? So something's going to give if you play around with your sleep time. So just being aware of that. Okay, exercise regularly. Yeah, don't do it right before bed, but actually exercise in the evening can help you get deeper sleep. Keep your bedroom free of sound and light. Obviously, this is intuitive, right? So just try to keep a good space. Keep it cool. Our bodies like to be cool at night, actually. And somewhere I read that the ideal temperature for sleep is actually around 16 or 17 degrees. That is way too cool for me. But so I probably keep it closer to 19. But actually, our bodies we get a little bit cold blooded at night. Our body temperature drops. And so if our body temperature drops just by a little tiny bit, the environment has to drop quite a bit more to keep us comfortable. So that's where the coolness at night is helpful. Don't go to bed hungry, right? Don't want that tummy rumbling waking you up. And then, of course, avoid excessive fluids at night, because we know that you might have to end up emptying your bladder in the middle of the night. And that includes caffeine. And so here's a list of all the substances that I, strongly encourage people to reduce at nighttime. Obviously, caffeine. But nicotine actually is a stimulant as well. So if anyone here is nicotine dependent, either vaping or smoking cigarettes, knowing that there's a couple issues. One is that the stimulant can cause your sleep to fragment. So even if you fall asleep okay, you might wake up a bit extra overnight. And also you go through a bit of that with nicotine withdrawal during the sleep time too. So that itself can wake you up if you are smoking into the evening hours. So just another thing to remember. And of course, obviously, as a healthcare professional, we would ask that everybody consider smoking cessation anyway, but just something to consider. And then alcohol. A lot of people will say, oh, I have a nightcap to fall asleep. And alcohol can make you sleepier, but we know that it breaks the sleep. So you're more likely to have light sleep if you drink before bed, and also have fragmented sleep where you have more awakenings. Okay. Don't take problems to bed. Now, I know this sounds like really obvious advice, but the question is, how do you not take problems to bed, right? Because I can say that, but it's not like anybody wants to take their problems to bed. They just come that way. So one of the ways that I encourage people to help their brains learn not to take their problems to bed is to actually plan something called worry time. So we know that, we can avoid our problems all day. We can kind of distract ourselves and be busy. But we know that those worries are going to find a time to creep in. And that's usually going to be when the lights are out and nobody's talking and there's nothing to distract you. And then that's when the mind starts to race. That's when you also become more noticing of your pain, et cetera, right? Because there's no distraction. So when I tell people to try something called worry time, what I'm trying to teach them to do, and what we're trying to encourage their brains to do, is to learn that it doesn't have to do it at night, because you're going to allow that time, that thinking, that processing some other time in the day. So the way to do that is to, try to maybe jot down some notes in the evening. If you're lying there, have a piece of paper and a pencil by the bedstand and scribble in the dark, a word about what's popping up in your mind. Then try to distract yourself again with, whatever. Some people will repeat the same words over and over again sometime, or do some counting or whatever, knowing that that's not enough. Those thoughts are going to keep peeking in. But with time, if you get into the habit of taking that, that list of notes that you've made and sitting down during the day earlier, maybe 4 p.m. the next day, something like that, and giving yourself some time just to look at that list and say, okay, worry. This is my time to worry. What's going to happen is you may spend 5 minutes, you may spend 5 seconds, because you might look at that list and say, well, there's nothing here to do. Like I'm not worried right now. That's okay. What we're doing is we're training our brains to put our worries aside at night, because our brains will trust us that we're going to address these problems the next day. So this is about process, not content. It doesn't actually matter what you write on that paper, and it doesn't even matter what you do when you sit down during your worry time, as long as you're basically telling yourself, okay, this is my time. What was I thinking about last night? What might come to mind tonight? What are some of the things that are going on in my life that I'm avoiding thinking about? Do it for a few minutes, put it away. If you get into that habit, it's going to be so much easier at night when those thoughts start creeping in, for you to just say, you know what, this isn't the time. I have time for this tomorrow at 4 p.m. at my worry time, right? So it's about training your brain away. Don't try to fall asleep. So Professor Colin Espy, who is a graduate supervisor of mine, and just this, in the sleep world, he's like a hero. If he's at a conference, everybody's like, "Oh, Professor Espy, Professor Espy." He actually coined this model of insomnia that he calls the attention, intention, effort model, meaning you're actually more likely to develop insomnia if you pay a lot of attention to your sleep and if you try too hard to sleep. Because sleep is one of those things that the more you try, the worse you do. And here I am aging myself a little bit, like the little engine that could. Isn't that from the 70s? But we all know it, right? I think I can, I think I can, I think I can. And this is one of the few things in life that the more you try, actually, the worse you do. So don't try. If you're not falling asleep in bed, get out of bed, sit in the dark or dimly lit space, do something boring, do some repetitive reading, repeat the same mantra over and over again. Just let it go. Try to stay awake. It's okay. Just do something calm and relaxing, and then try again when you feel that wave of sleepiness coming on. Hide the clock. Like, so many people can tell me exactly what time they woke up through the middle of the night. And really, that doesn't help you. It actually puts this unintentional pressure on you, because you'll look at the clock, and no matter how hard you try, you'll do math, right? You'll think, okay, it's 2:30 now. I know I have to get up at 8. I have exactly 5.5 hours left. If I fall asleep in a half hour, then I can still get 5 hours. You may not be actively thinking those thoughts, but it's there. Your brain knows. Your brain is going to be thinking, oh my goodness, I need to get sleep. I need to fall asleep. Or if it's an hour before your alarm, your brain will think, nah, there's no point. Right? So we don't want to look at the time. And so it's really important, I think, just to set that alarm. You just set an alarm. We talked about wanting to wake up at the same time every day anyway. That will help you fall asleep at the same time the next night, but it also takes the pressure off of having to check the time in the middle of the night. If your alarm hasn't gone off, it's still sleep time. And that's all that really matters, right? So really, really try to avoid, turn around the clock or move it away the other side of the room. Try to avoid looking at it. And then finally, avoiding naps. And really this is just about trying to avoid the sleep drive getting disrupted, right? So if we have a nap, then we're more likely to struggle to fall asleep at night. But there are caveats, right? That's tricky, right? If you're unwell, sometimes there's a need. Your body needs that extra sleep. And that's okay. You can still nap. But try to move that earlier in the day if possible. Try to set an alarm for the nap. We don't want to nap for like 3 hours. Try to limit it to maybe 60 minutes. And try to differentiate that sleep from nighttime sleep if possible in some way. So if you have the luxury of having a separate place to try to sleep for your nap, go there. If not, then again, try to, maybe switch up the side of the bed that you're on, or flip yourself upside down. Do something to differentiate night from day, because that becomes really important in terms of training our brains at night. And remember, resting is okay, and naps maybe too, depending on the situation. If you don't need to sleep though, like you're not in a position where you're so excessively sleepy and your health is at its baseline and you don't need the nap, try to avoid it. And then I just sort of mentioned this again, that rest in the bed is not actually the same as sleep, right? So rest and sleep are very different. You're not getting the same changes in your hormones and your inflammatory markers in your brain during lying down awake to rest as you are during actual sleep. Sleep is very, very distinct in what it does to your body. And so if you feel like you need a rest but not sleep, try not doing it in your bed, right? Outside of the bed. Okay, so you know what? I zoomed through that and I hope that it stuck. But yeah, just so in conclusion, remembering that pain and sleep affect each other quite a bit. And it was surprising to me when I reviewed the research and the literature at how much heavier the arrow is going from sleep to pain than from pain to sleep. So the impact of your sleep on your pain is actually higher than the impact of your pain on your sleep. And so I think that makes it a good target for treatment, actually, of pain as well as sleep. Good sleep hygiene is protective, but if you need more help because you're suffering from persistent difficulty and it's affecting your function and your pain control, make sure you bring it up. Talk to your healthcare providers about it. There are a lot of resources out there to get more help with the sleep. Locally and through online services now, and a lot more people around our communities are trained in addressing sleep disorders. So just make sure that you don't ignore it. It's very important. It's a big part of your self-care and your pain management. And that's it. And that's one of my little sleeping beauties over there. So yeah, so I'm happy to take any questions right now.
Excellent. Thanks, Dr. Bodani. And she is a little sleeping beauty. That's adorable. I have to say, I tried to get down to that 16-degree temperature and nope, that's chilly.
Yeah.
Yeah, 19 is about the maximum. So I'm just going to scan through the chat. Some good questions. I see one. What can be done about a snoring partner besides grumpy glaring? Yes, snoring. Great question. Thanks, Susan.
I think it's really important to figure out why the partner's snoring, right? So like maybe they have sleep apnea, and that I think is really important to get addressed. So, encourage your partner to go ask that question to their healthcare provider, because there are some quick scales they can do to figure out their risk and to just decide if they need to have a home sleep study or something like that, because that can be a quick answer. Now, some people snore and don't have apnea, right? So there's no quick solution to that. Sometimes snoring is positional, so you can kind of elbow them a bit till they're on their side, or get one of those side sleeping pillows, because most people who don't have sleep apnea that snore are going to snore less on their sides. So wedge something under their back so they're not on their flat on their back, or even sleeping a little bit more elevated can decrease some of that, decrease the floppiness of the airway so that they're snoring a bit less. And otherwise, my friends, earplugs. It's just so hard. There's nothing else you can do as long as they're still snoring.
Awesome. A couple of other questions for you. A lot of the folks that I talk to that have chronic pain often talk about frequent wake ups. Their pain wakes them up. They're up frequently through the night. Any suggestions around that and kind of how to manage them and navigate them? And especially when it's hard to fall asleep or you're waiting for meds to kick in?
Yeah, no, and I hear that quite a bit also. So sleep fragmentation is going to happen from pain, but it's also going to compound as we age, right? So if I was to show you a picture of a sleep hypnogram and show you how people's sleep looks as they age, what you'll see is the awakenings just ramp up. So I try to encourage people not to worry about the fact that they woke up, right? Because sometimes that just in itself brings about a bit of a panic, like, oh no, I'm up. It's not time to wake up yet. It's over, right? And so part of it is kind of embracing the wake up and not panicking about it. And then it's about strategies during that wake up, what to do, right? So if it's feeling like it's been more than 15 minutes or so, again, you're not looking at the clock. So you're gauging your own kind of internal clock. If you wake up because something has tweaked you, the pain kind of kicks in, and you're still in a drowsy-ish state, you're pretty certain you're going to be able to fall back asleep, go ahead and stay in your bed and try. But if it feels like you're wide awake now, your mind's on, you can feel that level of like, I'm wide awake. You get that feeling, or you've been sitting there drowsy, but not falling asleep for what feels like 15 or 20 minutes. That's when it's important to get out of the bed, right? You don't want to keep lying there. You want to limit your awake time in bed so that you're not teaching your brain to just wake up and lie there. Because the more you do that, the more you can predictably expect that you'll continue to do that. So there's a self-reinforcement that happens. So if it feels like it's been more than 15 or 20 minutes, or if you just feel completely wide awake and know you're not getting back to sleep, get out of your bed, sit in a comfortable chair, and do something very boring. One of my favorite exercises to give people is progressive muscle relaxation. And so if you Google progressive muscle relaxation, you can find some YouTube guided videos. And if people just practice that, the idea of you just start at your feet and you work your way up your body where you contract, count down from 10, relax, and then keep moving up. It's boring. It involves counting. It's repetitive. It checks off all the boxes of things to do in the middle of the night. And it doesn't usually exacerbate pain for the most part. If there's like a body part that's bothersome, don't contract that part, right? So do that until you feel that sleepiness coming back in, then get back into bed. If you get back into bed and you feel wide awake again, or you lie there for 15, 20 minutes and it's not working, back out of bed, right? So there's this little bit of going in and out of bed that's actually really important to do. If it's frequent awakenings, but you're able to fall back asleep quickly enough, there's not too much to do about that, but it's also not too worrisome. Okay. So we've seen as people age, sleep fragments, it doesn't mean that they're going to be persistently tired. If you can get your brain back into sleep, you'll be okay. Right. So it's just about just staying with it, but you don't want to exacerbate things by having these long awakenings, because the more long awakenings you have and you lie there in bed and stay there, the more likely you'll continue to have long awakenings. Now, for some people, I have some patients for whom it was too hard, like it's too much pain to get up and out of bed every single time. And for those people, I would say, okay, fine. If you really need to stay in the bed, stay in the bed, but prop yourself up. Like give your brain the signal that you're not sitting here just lying here trying to sleep. Prop yourself up. Do some of that progressive muscle relaxation. There are actually a lot of other kind of boring sleep strategies that you can look up that are repetitive. You're not sitting there saying, try and sleep. You're actually sitting there saying, okay, I'm going to do this really boring thing over and over again as many times as I can. And so it's a bit of paradoxical intention. You're not trying to sleep. You're just going to bore yourself until the tiredness kicks in and takes you to sleep.
Okay. I'm just going to take 2 more minutes for questions. Dr. Bodani has to head out right after this. So we had a question from one of our participants. Dawn was asking if you can't wake up to your alarm. So she has multiple alarms set and can't wake up to an alarm. Any suggestions around that, or where to start?
That is tough. And I don't have a ton of good suggestions. I usually, I often tell people definitely to always rotate your alarm, because your brain gets used to something and it's easy to then sleep through it. If nothing wakes you, like most of the time you end up needing someone or something external to come and shake you out of bed, right? One thing you can do is heat yourself out of bed. So if you can crank up your temperature a bit earlier in the morning, because again, as you're sleeping, your body gets cool. And then, you like to be in bed in that early morning hours when you're kind of feeling cuddly and warm. When, the worst nights are in the summer when it's super hot and you're not able to stay asleep. So if you can actually adjust your thermostat to warm up the house at like 6 a.m., that's way sooner than your body would usually want the heat. And that might make you uncomfortable enough to get into a lighter sleep. So you might actually hear that alarm. But yeah, loud alarm, rotate them up, put them on the other side of the room so they're super annoying, so you can't hit a snooze button ever. If you completely sleep through it, I don't know what else to offer.
Well, Curtis suggested a water gun.
Yeah.
Can I bring something up, Tom? Doctor, hey, in my case, when I lay down, like I got a septicemia and my pain elevates as soon as I lay down. And if I do sleep for 2 hours stretch at a time, that wakes me up because I'm in pain, a higher level than I laid down with.
Yeah.
And I follow your rules pretty good without hearing them from you, like temperature down. No, I don't drink coffee, period. And
Perfect.
the drinks and all that stuff. I think I follow that pretty good. But I'm actually at a point where I'm scared to go to sleep because I know my pain's going to elevate instantly on the back of my head.
Yeah.
It's not, I haven't got a sore bone in my body. It just the elevation of the pain to the back of my skull. And when I do sleep for an hour or two, I've been 5 years with a sleep problem, major sleep problem.
Right.
And I just don't know what to do with it. I've talked to a lot of people and I've got no answer. Sorry, go ahead.
No, I was going to ask, if you sleep for less than that amount of time, is the pain okay? Like if you were to get 90 minutes, like, or is it like, what's the maximum amount of time you could spend in that position without getting pain?
Oh, the odd time I'll go 3 hours, but it'll wake me up every time, the pain in the back of my head.
Yeah.
And as soon as I lay down, it elevates myself. So I just kind of work through it, concentrate through it. And I do fall asleep for a couple hours at a time at the most normally. And then I'm up because of the pain.
Yeah. So one thing is to see if there's any other positions, right? If there's any other way to sleep so that you're not getting the pressure. So you can get all kinds of weird pillows and stuff like that. So I don't know if you've ever
yes, I've tried.
Yeah, so that's an option. For some people, I do schedule awakenings, and so that's why I was asking about how much time can you tolerate? Because let's say that it's really bad if you sleep for 2 hours, but you can handle it for an hour and a half. Then I would have told you, okay, set an alarm so that you're always switching your position at a certain amount of time. But it sounds like for you, any amount of lying down causes.
As soon as I lay down in bed, the tension increases instantly. And I've explained this to doctors. I explained it to a lot of different people, and they have no answer for me.
Yeah, I can't tell you that I have anything because there's nothing about this. No, there's nothing about the sleep, right? It's about the pain. So I think you'd have to look at what's the most creative positional solution, right? So, like can you be a side sleeper or a stomach sleeper? Is there any other way to prop you so you're not aggravating the pain from the position? Humans usually lie down to sleep, but they don't have to, right? So we've got people who sleep in recliners. It doesn't take away from your sleep, but it just makes life a bit harder, right? If you're traveling or if you're not in your own home. But if it's the position itself and not the sleep, but the position, I think the only solution is to look at other creative ways to be able to find different positions to sleep in, which is possible.
Yeah, thanks for that, Dr. Bodani. And that might have answered one of our other questions just about pillows and positioning in bed. And so what I'm hearing is it's worth exploring some of these other opportunities. Mm-hmm. Yeah. Okay. Thumbs up or thumbs down weighted blankets? Just super quick.
Oh,
you only get a thumbs up or both?
I don't know. I think for some people they're great, but for others, they're not going to solve the problem. So if this is about just keeping you comfortable, if it's a temperature thing, right? But if you already have a broken sleep, if you're already suffering from insomnia, it's unlikely to be able to fix the problem.
Sounds good. Thank you for that. With that, Dr. Bodani, thank you so much. Every time I take something away, I'm going to work on worry time now. Thank you for being here again, and take care. Have a great rest of your evening.
Thank you. Bye. Take care, everyone. Thanks for having me.
So we'll move on to our next speaker. I'm going to welcome Jessica Jack. Jessica is a member of the Improving Pain in Saskatchewan team, a medical anthropology student, and someone with her own lived experiences of pain. She believes that stories contain the power to bring us all closer together and share in healing. So she is looking forward to sharing her story. So welcome to Jessica, who's joining our conversation now.
Thank you, Kelly.
Hi, now I see you. Hi, how are you?
Good, thanks. How's everyone doing tonight? Good. Well, I'm going to echo a lot of points that Dr. Bodani made. Holy moly, do I see a lot of my own experiences and what she was talking about. So let's get into my experiences with pain. So I've had pain basically as long as I can remember. I can't remember a time in my life where I didn't have some kind of pain. And my pain is kind of threefold. I experience it in my gut, which is generally short, sharp, very sudden, very panic kinds of pain. I experience it in my legs, lots of that throbbing kind of muscle achy sort of pain without direct causes. And then my feet, I seem to have hyperextension, which means that my feet are basically flat as pancakes, which means that it's really easy for me to have pain in them. And unfortunately, I'm not sure the origin of my pain or exactly where it comes from, but it likely stems from trauma in my childhood. I had an abusive childhood and my pain wasn't taken seriously, so I didn't get any medical help for it until I was an adult and able to seek that out for myself. But I first tried to address my pain when I was about 14 years old because I was waking up with sudden pains at around 4 a.m. every day, no matter what I did. Eventually, I kind of just started rolling with it and showing up at my high school at about 7 a.m. every day because I was already awake and getting out of the house was great. But when I saw my GP about it, there were no conclusive outcomes besides a prescription for Paxil for my depression, which was seemingly at the root of my sleep problems at the time. So I kind of just lived with sleeping only 4 or 5 hours a night for years, lots and lots of years, actually. I was often quite ill as a result because my lack of sleep and my ongoing pain seemed to make me susceptible to every germ that came around. So, it's what Dr. Bodani was talking about, how these things compound and compound and compound. So lack of sleep was making everything else worse too. Since I was 14, I have talked to a plethora of doctors, but no one had any suggestions that would help me besides a whole parade of medications that never worked. I'm pretty sure you guys can all sympathize with my experiences here because as I've done pain work, I know that this is a very, very common story. I have seen, and I sat down to write out this list for this talk today. I have seen neurologists, gastroenterologists, psychiatrists, podiatrists, rheumatologists, dermatologists, endocrinologists, and allergists, to say the least. And the underlying theme of every visit I had with any one of these medical professionals was that they were well-meaning people who quickly gave up after they couldn't find answers to my problems within their own specialty. There was no communication between any of them, and generally very little communication even with my family doctor, who had a great bedside manner, but didn't really seem interested in finding answers either. It was generally like, okay, well, they couldn't find an answer, so, shrug, move on. So I don't have a diagnosis after seeing all these people. I instead have a lot of, it's not this. So what my pain is not is, it's not carpal tunnel, it's not arthritis, it's not IBS, it's not sleep apnea, it's not a herniated esophagus, it's complex regional pain syndrome, it's not lupus, it's not fibromyalgia, it's not a whole host of things. The only firm diagnoses I've ever been given are I have hyperextension, which means that I'm extra flexible. My ligaments don't stop moving quite at the right angles. So like with my flat feet, that can cause problems. And I have also received some mental health diagnoses, including PTSD and anxiety. After every single doctor's visit that was inconclusive, their suggestions about my sleep were improve your sleep hygiene, drink more water, relax, super helpful. I hate that advice. Try not to think about your pain and your tiredness, and then just take this pill that generally has worse side effects than the thing that you're trying to treat. So after all of that, I kind of just thought my pain was normal, was just how I was meant to live every day. And unfortunately, that resulted in things like isolation, worsening mental health, decreasing ability to live independently, and basically just resigning myself to a mediocre life. But I had a big reckoning in 2015 when I experienced another serious traumatic event that left me unable to function as a human being. I was basically just a lump on a couch, couldn't do anything else. And when it was obvious that this problem wasn't just going away, I sought out another round of doctors, one of whom finally suggested I seek counseling. So I started to go to mental health therapy. And I had been to therapy earlier on, but it never really did anything. So this time, the thing that changed was I found the right professional who I clicked with and who took the time to understand my situation. So what followed was 6 years of weekly therapy and daily yoga, actually, that have made pain changes that no medical doctor was ever able to make for me. So I now consider my pain to be well managed, but not eradicated. And I have to note here that I was very, very, very privileged to go through these 6 years of weekly therapy because I had the money to pay for it. And I know that very few people are in that same boat. So how does pain impact my everyday life? Well, in a couple of ways. So I can't do repetitive motions with my hands or my arms for very long. I can't write by hand. I can't paint. I can't chop very long, those kinds of daily tasks. Can't stay on my feet for very long. I have an encyclopedic knowledge of every location of every bathroom everywhere I go, just for the bad days. But mostly the biggest impact is on my sleep. I feel like I'm my own self-certified sleep expert at this point. So for me, waking up early is the problem that I have. Generally speaking, it's around 4 a.m. every day, but it can be as early as 12:30 or 1 a.m. on really bad days. So it's a couple hours of sleep and then I'm just up. Also, falling asleep can also be really difficult if my pain is bad, especially gut pain. It's just almost impossible to ignore, so my brain just stays on. And unfortunately, my sleep is not always very restful. For me, pain induces intense dreams or on bad days, intense nightmares, which makes my sleep feel like I'm not asleep. I'm just awake in a different realm, essentially. And pain also contributes to parasomnial disorders for me, which are things like sleep talking, sleepwalking, sleep paralysis, and regularly waking up throughout the night without actually waking up. My poor partner has had so many nonsensical conversations with me, I can't even describe. But unfortunately, all of this leaves me perpetually tired because my brain isn't in that restful state of sleep that it should be. So I generally go to bed early, quite a lot. Bad days as early as 8 p.m. 10 p.m. is closer to regular bedtime, but I'm still averaging about 6 hours of sleep a night when I should be getting around 8. This lack of sleep gives me difficulty with cognition. So sometimes thinking is hard. And that always sucks, but it especially sucks because I'm a grad student. So, thinking is something I need to do. It gives me memory problems. My long-term memory is very piecemeal. I don't always trust it. And I've missed out on lots and lots of social stuff over the years, which adds to feelings of isolation because generally speaking, people like to party at night. And I try to sleep at night and generally fail at it. So, it doesn't always go very well. But I've definitely found some things that have been helpful for me. I've mentioned a couple of them when I talked about my big reckoning. So I wanted to preface this by saying the things that work for me might not work for you. The one thing I've noticed about pain and sleep is it's very individual. It's really oriented to your body chemistry and your individual physiology. So I'm not trying to tell you to do these things. I'm just telling you what worked for me. One of the biggest things that changed for me was a prescription for medical marijuana. THC heavy strains before bed help to keep my sleeping brain quiet, which reduces that parasomnial activity, so the sleep talking and the sleepwalking. And it also reduces the intrusions of pain into sleep, which is not to say I don't feel the pain, but it's just that it doesn't penetrate into my sleeping brain and wake me up. And the amount of marijuana that I've needed to sleep better has actually decreased as my pain and my coping abilities have gotten better. So I'm hopefully weaning off of it, but it's been a slow kind of progress. Yoga, oh my gosh, daily yoga has reduced my regular body pains, both through exercise and movement, and because for me, daily yoga is meditation and mindful breathing. So that helps to calm the sympathetic nervous system and activates the parasympathetic nervous system to induce those feelings of calmness. Yoga also helped me to establish that routine that Dr. Bodani was talking about, and routines make it easier to keep doing the helpful activities. So daily yoga is a must for me. Mental health therapy, oh my gosh, taught me how I was contributing to my own pain, which I was doing in spades, and didn't realize until someone was like, oh, hey, you're making things way worse for yourself. So that was helpful. It gave me self-advocacy skills so I could go back to other professionals who could help me and advocate for myself. And it helped me to differentiate between pain coming from old memories and experiences that are no longer in the present, or pain coming from current stimuli, which actually helped to reduce my pain overall. Sleep hygiene, I won't go into that too much because Dr. Bodani talked about it, but I do try to practice stringent sleep hygiene. And then lastly, there's 4 books that I really loved. I'll go through the titles really quick, but we can send out the titles with the email after the talk. So the first one is The Body Remembers, Psychophysiology of Trauma and Trauma Treatment by Babette Rothschild. The Gift of Fear by Gavin de Becker, because it's a lot easier to not fear things once you understand them. The Body Keeps the Score, Brain, Mind, and Body in the Healing of Trauma by Bessel van der Kolk. And then lastly, the Post-Traumatic Insomnia Workbook by C. Laura Franklin and Karen Thompson. It's a lot of reading, but all of those things have really helped me to understand myself and what I have done to both contribute to and help with my pain and sleep. So lastly, I'll end off here with a piece of advice that I received that made a difference in my understanding of pain. Listen to yourself. For me, my body's trying to tell me something when I feel pain, and listening to what that message is, instead of shutting it out and hoping it will go away, was the first step to working through everything, but also my sleep and pain problems. So that's been my experience. I thank you guys so much for listening, and I'm willing to take questions now. So.
Thank you, Jessica. That was a fantastic summary of everything. And you just went through all the questions that were popping up for me in my head. And I really appreciate how candid you are with your experiences and your willingness to share. Something that stood out for me is just like the trial and error and finding the right people and just having to go through a couple of things before it worked, before you found things to work. So I am going to hold questions and answers. We're running a little bit behind schedule right now, so I'm going to try to do a bit of catch up. So we're going to hold questions and answers for Jessica until after Taylor, our final presenter's presentation. So Jessica, if you're okay to hold tight for us, and then feel free to put questions into the chat for Jessica. I am going to roll right into Taylor's presentation right now, and we will probably go over a little bit. Taylor has about 10 to 15 minutes of things to share with us, so hopefully you folks are okay to hang tight and bear with us as we go over a little bit, but this is all such great information. So let's bring Taylor then to our Zoom stage. So Taylor Raiche is a pharmacist, a clinical pharmacist at the Medication Assessment Center, and I'm so proud to call her a colleague of mine. She very much enjoys working with individuals who use medications to educate and empower so that their medication regimen is effective and safe and convenient as possible. Taylor enjoys taking on projects around the house and yard and is excited about crafting and creating for the holidays over the next while. And I have to say that we have been able to, as coworkers, partake in Taylor's creativity and craftiness, and it is unbelievable. So she's an awesome pharmacist and really creative on the side. So with that, here's Taylor.
Thank you, Kelly. Can I get a thumbs up if you can hear me okay? Good. Okay, so you can hear me, and I'm hoping you can see me as well. And let me apologize for my choice of attire today. I'm seeing as I've turned my camera on now, the stripes are not communicating well. So if it's making anybody nauseous or dizzy, please let me know, and I'll maybe just like slide under my table so you can't see the shirt if it's causing you to feel any type of vertigo as you look at how it is. It's really bad on my end. I really hope that it's not that bad as it's coming across on your end. In any case, let me share my screen here, and we will really try to whip through as quickly as possible the presentation I've got today, but hopefully there are still some key takeaways I can share with you. And so Kelly, can I get a thumbs up if you can see my screen as well? You're seeing my PowerPoint and not my speaker notes, is that right? Good. Okay. So as Kelly mentioned, my name is Taylor. I am a clinical pharmacist by training. I do about half of my time in chronic disease management, general medication assessments at the Medication Assessment Center. About half of my time is spent in the world of chronic pain, working with individuals who live with chronic pain and all of the associated things that come along with that. And overlapping both parts of my work is talking to people about sleep. I meet a lot of people in a year who are concerned with their sleep. And so Dr. Bodani earlier was mentioning a process called cognitive behavioral therapy for insomnia, or CBTI. I'm one of the trained pharmacists in the province who does provide CBTI at the Medication Assessment Center. And so that's kind of my background and where I'm coming from in talking to you today. So my focus is going to be on giving you some practical tips and tricks I'm hoping that you can take away today to help you relax. That being said, I might not be Jessica's favorite person talking about relaxation today, but hear me out. Maybe there are some things in here that you haven't heard of before or haven't thought of before. And the idea being, as Jessica mentioned earlier too, it's not a one-size-fits-all situation. There are so many different ways to manage sleep and co-manage pain, and you have to find what works for you through trial and error, but I'm hoping this gives you some ideas. So one thing for you to think about is just maybe reflecting to yourself, what are some of the common thoughts you might notice when you're trying to fall asleep at night? And if you're brave enough, you can pop some of those in the chat, but I'll just give you maybe about 10 seconds or so. The first thing that comes to mind, what comes to mind as you're lying in your bed at night, wanting to fall asleep? That's not happening yet. Take a moment to think about that. One thought, grab that out of the air. Yeah, Susan said, always work, remembering things that haven't been done today, probably should be done tomorrow. Work often pops up for me. I'll have random patient names pop into my head in the middle of the night and think I should make a call about something. Worries, past events, it sounds like Curtis, there's maybe some trauma, and those things can certainly resurface in the quiet of night. Thanks for sharing, folks. The second question I want you to think about then is, what kind of emotions do you find tend to surface as you have these types of thoughts at night? Labeling some of those emotions, what might they be? A few moments to think to yourself, that thought, what emotions come along with that thought that you had? Anxiety, regret. A lot of the time, anxiety, helplessness, frustration, guilt, grief, I hear often, anger, anticipation, worry, all of those emotions, they do tend to have somewhat negative connotations to them. They're not emotions that we like feeling. These are icky emotions. And so then the third question is, what do you do to try to manage those thoughts and emotions as you're laying in bed? How are we actually addressing them, if at all? Are we distracting ourselves? Are we processing those thoughts and emotions? Are we writing them down? Are we getting up and out of bed? Distraction sounds like a technique some folks are using. We could do any number of things, and important to take a step back and look at the big picture. Chronically, what are we doing? Are we seeking help from a doctor, maybe a medication to try to quiet our mind at night? Are we turning to using cannabis, perhaps, as a way to help manage our sleep, to get us falling asleep faster? There's any number of things that we could be doing, going to bed earlier, staying in bed later in the morning. Sarah mentioned that she's really trying to think of positive thoughts. Susan said breath control practice. The point being that each of these three distinct pieces, your thoughts, your emotions, and your behaviors, they're all interconnected. This may be a new concept to some, and this may be very intuitive to some. But the idea being that as you have a thought, it can very quickly lead into emotion without even thinking about it. Our brains can work so quickly. Those emotions can turn into behaviors over time. And when those behaviors don't pan out in the way that we want them to in terms of helping us sleep, they sometimes can be counterproductive, what then happens is we go back to more and more of those thoughts. And around we go in this merry-go-round we don't want to be on. We need to break this cycle somewhere. And so my role in providing cognitive behavioral therapy for insomnia, or CBTI, is helping people break the cycle. How do we stop those thoughts from eliciting emotions? How do we change some of our behaviors so they're not driving these thoughts further? And today we're really going to focus on addressing the thoughts, so we don't have so many of these emotions cropping up that serve to be counterproductive towards our sleep. Again, this is the idea behind cognitive behavioral therapy for insomnia. And so today we're focusing on relaxation and distraction techniques, which is only one of 5 key areas I work with folks on when we do CBTI together, but it's a very important piece. So today we're going to focus on some really practical tips and tricks I'm hoping you can take away from today in the areas of breathing, progressive muscle relaxation that you've already heard a bit about, imagery, and more of a novel technique called the cognitive shuffle, or cognitive shuffling. And again, don't forget about the good sleep hygiene pieces. I know it sounds like low-hanging fruit, but it's a very important piece in managing your sleep. And then, as I mentioned, there are 3 other CBTI techniques, and that includes sleep restriction, which I call the iron hammer of sleep therapy. So if anything's going to work, it's typically sleep restriction, but it's a pretty involved process with a therapist to do that, and 2 other techniques as well. But today we're focusing on the relaxation pieces. So deep breathing. Couple terms for this that you may have otherwise heard in the past: diaphragmatic breathing or box breathing. I know that there have been other practitioners and folks with lived experience who have shared some breathing exercises in real time in previous Partners in Pain sessions, so we're not going to do that today, but I did want to give you a few more resources if you're interested in adding anything to your collection. And so you will get these slides sent out to you, I believe, tomorrow. Celine's planning to send them out. So all you have to do is simply just type in diaphragmatic breathing, which is breathing from your diaphragm, so making sure you're really creating space in your chest by pushing out your belly as you're inhaling, and then the opposite, contracting that. So you're really giving your lungs a chance to inflate. Box breathing is another technique that involves some visualization. And so there's some really quick, lovely YouTube videos there that you can take a look at. I'm a big fan of mobile apps, particularly the breathing app that you see on the right there. This is one of the simplest and most intuitive apps I've found to recommend to folks in my practice. And so that gray ball that you see on the screen there, you can imagine that that's your actual phone screen in front of you. What happens is as you set the timer on this app, that ball starts to inflate. You can see that ball get bigger. As you're seeing it get bigger, you're imagining your lungs inflating and taking a nice deep breath in. And as the ball starts to shrink again, you're visualizing your lungs releasing that air, breathing out. And so just a really nice visual. It's almost kind of hypnotic in a way to watch this. And there's a really nice sound in the back, just a very gentle tone that shifts just a little bit as you're inhaling and exhaling. A really nice grounding technique. I even find when I'm getting a little bit worked up or feeling a bit anxious, all I have to do is put this app on my phone and I can just listen to that sound, the tone change for the inhale to the exhale. And that can really help anchor your breathing and structure it to help you get into that calming of your sympathetic nervous system, as Jessica was talking about earlier. Another app is called Breathe. You see that there on the left. This one is free to download, but there are a number of modules in it that you can pay additionally for. But I think that a number of the free ones are actually probably worth downloading the app just for those. So lots of guided exercises, again, to really structure your breathing practice. And it's a practice. It takes development over time to get these skills in order, but really calming your nervous system and prepping it for the other activities is a foundational skill to get your brain in the right spot. So building on that, we've got the idea of progressive muscle relaxation, and we've heard a little bit about this already tonight. It's really the idea of connecting the body to the breath to get you into deeper rest. And so as was discussed earlier by both Dr. Bodani and Jessica, the idea that we're taking different body parts one at a time in isolation, and we're focusing on contracting or squeezing them to bring some physical attention to that area, and then releasing, working on the breath as we're doing that. Again, as people who might live with pain, I can appreciate that this can elicit certain feelings that might always not be comfortable. And so what you can do if you're finding that a particular area is a little bit stiff and it doesn't feel good to contract and relax it, simply just bring some awareness to that body part. Just kind of bring some awareness. Sometimes I tell people, if you imagine a ball of yarn and you're just wrapping yarn very gently from your toes all the way up to your leg, it's like you're encasing yourself as a mummy. Toilet paper if you want. Think of something just wrapping all the way up, and as you're envisioning that, thinking about your body kind of becoming encased and really relaxing into that with the breath. If you're not ready to do this on your own just yet, that's no problem. Again, there are a million resources out there. This is one of my favorites on YouTube, and so you can just type that title into YouTube and bring up the 6.5-minute guided progressive muscle relaxation. Again, if anything's uncomfortable, simply just bringing attention to the area and not irritating it if that's uncomfortable. Moving over into the distraction techniques a little bit, we've got imagery. So the idea of focusing on not even a positive image necessarily, but just a more neutral image. Recognizing a lot of those emotions that we listed earlier tend to drag us down. And they weigh us down and don't feel very good. So can we change that energy and attention to something that's a little bit more neutral, if not positive? And so we're calming the nervous system. And so for just a moment here, if you could think about anything in the world, anything at all that feels nice to you, whether it's an emotion or a feeling, somewhere you've seen before, something you've heard, a taste, a smell, a texture, or a temperature. And just for a moment, take yourself to that place in your mind where you can experience some of these things. Really thinking through the 5 senses. What might you be experiencing in that place during that event with that person? For some, this comes very easily. For others, like myself, this does not. As Kelly said, I think of myself as a creative person, but my imagination isn't that wonderful. I'm always like stealing ideas from other people who are actually creative and have imagination and just putting it into practice. For some, though, who do have more creative minds, this is something that can be helpful for individuals. If it's not so intuitive for you, again, resources available out there. There are so many different guided imagery, audio files, or videos that you can just put on quietly, put your phone down, face down on your bedside table, and just listen. Let these images kind of come to you as you're hearing somebody with a soothing voice guide you through. And so another app I really like is called Insomnia Coach. It's been developed by the VA in the States for veterans who struggle with insomnia due to a number of complications from their service. There's a couple of guided imagery pieces in there that I really like recommending to folks. Imagining yourself kind of in a forest setting, on a beach, driving down a country road. Again, there's a number of different audio files you can find on so many different apps. This is just one feature. Insomnia Coach, by the way, is an app that's specifically developed to help folks with CBTI. So if you're interested in any of those other interventions like sleep restriction, stimulus control, or cognitive restructuring that I glazed over earlier, this is a really good start to start working on some of those pieces yourself if you can't find a practitioner. Now, one of the ones you may not have heard of before, this is a little bit of a newer concept, and it's called the cognitive shuffle or cognitive shuffling, or otherwise known as serial diverse imagining. And this was actually developed by a researcher out at Simon Fraser University in British Columbia. The idea being that your brain can only focus well on one thing at a time. And so if you can prompt your imagination to focus on random and diverse words one after another, kind of rapid fire, it keeps the focus of your brain. So those thoughts and anxieties and worries and stresses that are otherwise coming to you don't have as much room to penetrate into your consciousness. You're keeping yourself occupied with other thoughts. The importance being here that these thoughts are not productive. They're essentially meaningless. We don't necessarily want them to elicit any particular emotion that agitates you or excites you. They're just meant to be kind of mind-numbing words as we think through them, simply to occupy your mind. At face value, it can seem like easy work, but on the subconscious level, it's actually really busy work, and it does a really good job of distracting your brain. And so what this looks like, you can find a YouTube video. It's about 2 minutes in length that discusses this a little bit more. Here's another screenshot of an app that actually walks you through this process. So again, putting your phone face down on the bedside table, and as a word is said to you, you're imagining, using your imagination to think of what that word looks like, what that word smells like, what that object might feel like. And it can be any number of things. The idea being it's supposed to be completely random and keep you on your toes, but yet not elicit certain feelings that have the connotation of stress or worry. This is something you can actually do by yourself, and you don't need an app for it. So I teach people to pick an emotionally neutral word, about 5 to 7 letters long. And so the example I often give folks is airport. You can choose the word chair, flute, water, whatever you want. But you want to try to pick a word that doesn't have repeating letters in it. So words like banana or Canada, for example, probably aren't very good choices because you've got lots of A's in those words. You want them to have a number of different letters as you're choosing the word. And so now as you think about it, envision that written on a chalkboard in your head. And now, so one letter at a time, you're trying to think of as many other words as possible that start with that letter. And so then you start envisioning these items or places or events as they come to you. And so if I think of the letter C, this is just a list that came to my mind last night. Cherry. So I'm going to think about the sweetness of a cherry as I bite into it. I'm going to think maybe of being at the farmer's market in the summer when they bring in the BC cherries. I'm going to think about, how cherry pie has this beautiful glaze to it. It's so sweet. It tastes great with ice cream. When I run out of things to think about with cherries, I'm going to move on and think about sitting in a cafe. What does it sound like to sit in a cafe? What kind of drink might I get? How does that feel running down my throat? And so the importance is that if you come up with a word in your head, but you're having a hard time easily imagining it, just simply reject it and move on. You don't even necessarily have to imagine all of these words in their entire concept, but simply just kind of running through this list, exercising your brain to be thinking about the next random thing that comes to mind. And it's completely okay and normal, in fact, for your brain to diverge, go back to the thoughts it was otherwise having. But the important thing is to realize when you've gone off task and off topic, simply acknowledging, where's my brain gone? Okay, let's process that thought and let's move back to the activity. And so the more you do this, ideally, the more your brain realizes that that's just not a place for worry, that that's not a place for anxiety. We're going to do this boring activity, basically, until we fall asleep and feel sleepy. So when you run out of words that start with C, you move on to the letter H. When you run out of things that start with H, you move on to the letter A. On and on you go. And so this is an activity that is helpful for some folks who need that distraction. However, I have found in my practice, for some folks who are particularly productivity-based, they're to-do people, and they want to have an activity completed, this maybe is not the best activity because they find they're driven to complete the word before they can fall asleep. Myself, personally, I find this very, very helpful. Oftentimes, I don't even get through the first two letters, and I haven't even realized I've fallen asleep until the next morning when I wake up. So something for you to think about, the idea of cognitive shuffling. And again, that app that I showed here will help you do this, but an activity to do on your own if you wanted to try that mental flexibility there. One of the last tips I'm going to give you, the idea of counting. And I tell people, you can count, but don't count sheep. I don't really know what people say when they say, counting sheep. I guess you're just imagining sheep jumping over a fence. I used to have wallpaper as a little girl, and that was the image on it. So that's the image that comes to mind for me. But what I tell people is when you're counting, you're trying again to redirect that energy and attention on a clearly defined but a very boring task. So we don't want it to be productivity driven. We don't want to add things to your to-do list. And so one of the ways to do that is to try counting backwards in sevens. It's somewhat easy, but it's not entirely easy and mindless. You do need to actually have some math involved, some easy math as you do this. And so some of my tips are to start with a high enough number that you might not clearly envision getting to zero before bed, and start with a random number. So it's a little bit of that extra push, extra difficulty right off the bat. So if you pick the number 633, you're laying in bed doing some breath work, and as you take an inhale and exhale, what's the next number? 626. And you do the math in your head again. 619, 612, 605, 598. And for some folks, they don't make it to zero. That's kind of the goal. But counting backwards in sevens, if that's too easy, alternate sevens and sixes. Try a little bit of math to see if that can lull your mind. Again, the idea of taking your brain energy, putting it in a different bucket, or taking that energy that you're spending otherwise on having those thoughts that aren't serving you very well and moving them to a different place. And the bonus is to sing, but sing in your head. Dr. Bodani said that sometimes when people aren't sleeping within 15 to 20 minutes, we get them to go up and out of bed to do a boring activity, not something productive. If you are in too much pain to get up and out of your bed, like she said, prop yourself up, put yourself in a different state of mind. Don't actively try to fall asleep, but try singing "Oh Canada" to yourself in your head, especially if you have a bed partner, over and 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 over until you literally can't do it anymore. You fall asleep, your head's getting bobbing, or you're ready to close your eyes and go to sleep. And if your brain turns back on, you keep doing that. As the brain diverges to a different thought, you bring it back. The idea that we're training the brain like a small child with this negative reinforcement to continue to do these boring activities as opposed to some of the productivity insomnia that's driving the problem. And so I've given you some tips to think about some relaxation and distraction techniques, maybe some things you have or haven't heard of before. I will say, though, if none of these techniques are working within that 15 to 20-minute window to get you sleepier, it is a good idea, like Dr. Bodani suggested, to change your environment, get out of bed. Don't make yourself try to sleep. That oftentimes will end up being counterproductive. But it really is about the practice of it, training your brain, training your body. I always tell folks it's short-term pain for long-term gain. This can be a very difficult process, but it's like training a small child to learn how to sleep better. It really is possible, but it does take dedication over time. It's changing those neural connections. That's the concept of neuroplasticity behind this. I hope you have happy sleeping, that your bed looks as comfortable as this one does. I am happy to answer any questions that you might have. And if you're interested in cognitive behavioral therapy for insomnia, CBTI, I will put a plug in for our program at the Medication Assessment Center. We're happy to send out that contact information to you as well in the follow-up email. We accept self-referrals all the time. So if you're a chronic poor sleeper, don't like the word poor or bad, but if you're struggling with sleep and it's been a long time, come see us, and we're happy to try to help you in any way that we can. Thank you so much for having me today.
Oh, thank you, Taylor. We'll definitely include the referral information in the email package. And, you know, something that stood out to me after this whole evening of awesome information is that I've always kind of functioned that sleep should just come. Like, sleep is just what humans do. It should just be natural. But sleep is a skill. You know, and in the same way that I really suck at golf and I am not really a super great sleeper, I put time into golf for lessons. And same thing with sleep, right? There's some skills and some things we can do and some learning around it to be better sleepers. So thank you for that. We'll share all the resources and your slides with the apps that you've included. What I'm going to do, just because we've gone over, thank you to everyone that has stayed on. Once again, it's hard to stay on task and on time when we've got such great information coming our way. I'm going to hold questions and answers just because I want to get our poll out, and then just kind of a wrap up in case anyone needs to leave. And then we're going to stay on for anyone that might have questions for Jessica and Taylor. Certainly stay around, and hopefully Jessica and Taylor are both okay with hanging tight to answer those questions. Like I was saying, a big thank you to Jessica and Taylor and Dr. Bodani, who has come and gone, but for sharing their expertise, their experience, and your insight with us all this evening. Thanks for being a part of Partners in Pain. Once again, the recordings of the webinars will be available on the Sask Pain website following the presentation. The link to those will be shared with you by email. Feel free to share these with family and friends. Once again, word of mouth is working for us, so let's keep sharing. You will get the email tomorrow with all the slides that our speakers will be sharing, handouts, other helpful links. Will include some of the things that we've talked about today. There'll also be a link to an evaluation, so please complete the evaluation. Once again, that's important information for us as we continue to grow this program. Our next webinar is scheduled for Wednesday, December 1st at 2 o'clock in the afternoon. It's an afternoon session. Our theme for that webinar is massage. So certainly you'll have the link sent to you as a participant in Partners in Pain. Once again, share with family and friends who might want to join us. And thanks to each and every one of you for participating. It was wonderful to see you all, and we're so happy to have you join tonight. So I will, for anyone that needs to leave, certainly feel free to head out now. But if there are any questions, share them in the chat, or if anyone wants to come off of mute, it looks like Jessica and Taylor are both available to share their information. Yes, a few thumbs up. Just looking through the chat right now. Taylor, I'm just going to ask you this question really quickly, because these are all really great tools. But one of my comments was how, you know, you can start off with really good intention, right? And I might do this for a couple of nights. Any tips or thoughts on like, how do we get this stuff to stick with us? And I think probably people can relate to this. We all hear about what we should be doing and what should happen, right? But it's hard to get it to stick. How do you kind of coach your patients through getting these things to stick?
The first thing that comes to mind, Kelly, is self-compassion. I think if a friend were to come to us saying that they were struggling, you know, I can't keep on something, I've been trying so hard, but I just can't stick with it, you tell them to take it easy on themselves, right? Keep trying. When you're ready, you're going to be more successful when you're ready. And so what I think we don't want to introduce into it then is guilt, the obligation of feeling like you have to follow this playbook and things are going to work out for you. And I think that's exactly the purpose behind mindfulness, right? Is that you just recognize this is challenging to do. And so as you're having those feelings of frustration that come along with not finding that there's a great success in any of these number of things you've been trying, or that you have a busy mind that's distracting you from the task at hand, simply to acknowledge that and recognize that's part of the human experience, right? Compassion for yourself. And then just simply, once you acknowledge that and be compassionate, to bring your attention back to the activity. And we call this mindfulness practice, relaxation practice, because it is just that. It is practice, and it's a total shift of mind. The important thing to know, though, is that, we have plastic minds, the concept of neuroplasticity. We can form new neural connections in our brain between different concepts the more we do something. It's like trudging through the snow and pushing down more snow in a well-laid path as you go, time after time after time, which is a good analogy for a night like tonight. So thinking about the more you do this compassionately with yourself when the time feels right, the more second nature I think it becomes. Acknowledging that it's hard. Nobody can do this the first time around.
Yeah. Well, and I've heard all sorts of different numbers, right? Like I think it was maybe a Wayne Gretzky thing about how it takes like 10,000 shots to really master a skill. And I remember when I did smoking cessation as a pharmacist, it was like, it takes 3 months to learn to reframe new behaviors, right? Like you need to give yourself some time for these behaviors, and baby steps, Drina, your point in the chat, baby steps, right? And compassion along the way. Yeah.
Even new habits. I think they say it takes like 21 days to form a new habit. And so thinking is a habit in and of itself, changing your thinking patterns. So it does take time to develop those things that feel more comfortable, feel more like second nature.
Why do bad habits just kick in earlier though, hey? Like, yeah. Halloween isn't that far away, and I'm still very used to a treat every day, you guys. That stuck with me quickly. Okay, anything else in the chat? I don't want to go too far over here. I know some people are drifting off, and I certainly want to get everyone
I was
out to
just
whatever.
going to mention, Susan had asked earlier if I had any suggestions for yoga resources, and I had put it in the chat, but just in case anyone didn't see it, there's a YouTube channel. I highly recommend Yoga with Adrienne. She has lots of free videos. Most of them are very beginner friendly. She has a beginner series that if you're brand new to yoga, she walks you through how to get into it. She is fantastic. And I can send out the link in the email, the follow-up email, so that everyone can see it.
Excellent. Thanks for sharing that, Jessica. And yes, let's share that link with folks. So perfect. Maybe some bedtime yoga, right? But 3 hours before we go to bed.
Well, she does actually have like calm down routines too, where they're not physically stimulating. They're more just to kind of settle your mind and settle your body. So I like to do those ones before bed. They kind of are part of my routine. So I haven't found them to be interruptive.
Okay, I think that's where we're ended. We've all got a new activity or behavior, something to try before bed tonight. I'm going to commit to maybe some yoga with Adrienne. I threw a maybe in there, but I've got 16 people that I'm accountable to now. So yes. All right. Once again, big thanks to everyone for being here. Celine, thanks again for all of your behind the scenes work with this. Take care, everyone. Stay safe. For anyone that needs to be on the roads in the next day or so, be safe out there. All right. Okay. Take care, everyone. Have a good night.